Ryan Kronk. I am with the Water Institute at the University of North Carolina at Chapel Hill. We are the Secretariat for the Washington Healthcare Facilities Community of Practice, and we're very excited today to host the World Health Organization, UNICEF, and colleagues with the presentation on the findings from the WashFit status report. I'll just to give you a quick run of show, after I sort of make a few updates, we will hand it off to, we're going to present the report in a unique way. It's going to be a question and answer. We'll then have some country reflections. We'll have an announcement about the new, or the WASH Fit training package on the WHO Academy, and then have an opportunity for discussion and next steps. So a few housekeeping items. If you haven't already selected your language, we do have French interpretation, so please do make that selection. If you have questions for our speakers, we will have ample time for discussion. So we do ask that you drop those questions in the chat, and we will compile those and ask those to our presenters. And with that, I will introduce our first speakers. We have John Brogan, who is the Senior WASH Advisor for Helvetas and in the Swiss Water and Sanitation Consortium. And he will be interviewing Arabella Hayter, who is Washington Healthcare Facilities Consultant with the World Health Organization. So I will turn it over to the two of you. Take it away, John.
Thanks, Ryan. Hi, Arabella.
Hello, everyone. Hi, John.
Hey, congratulations on this report. Congratulations to you and the team on putting this together. I know it took quite some time and a lot of sleuthing to put this data together. So really well done. What really jumped out at me when I first opened the report was just the number of countries and also the number of contexts where WashFit has been taken up. I mean, 71 countries, rural, urban, you've got emergency settings, you have, public settings, private settings. And in particular, I think there were 31 countries that have national versions of the WashFit tool, and another 20 or so where the Ministry of Health has fully endorsed WashFit as a tool within the system. Can you tell us more about that? Talk about that in your experience with this report.
Yeah, so we're really excited to launch this report, and particularly excited that we now have evidence of so many countries using WashFit. So as mentioned, over 70 countries that we know of. You can see there a map in the top left-hand corner. The ones in light blue are countries that responded to the survey that we ran at the beginning of 2024. And then those other countries in darker blue are ones which we found out about through other means, or who were already known to be using WashFit. And of those 70 countries, some were countries we actually didn't know about previously that were using the tool, so that was news to us. And that indicates that there are probably likely more countries that maybe didn't respond to the survey that are using or have used the tool previously. Really excitingly as well, the number of countries is growing year on year, as you see in the graph in the on the right-hand side of the screen, since it was first launched in 2015, so yeah, almost 10 years ago. As you mentioned, we have countries using the tool across a huge range of different settings. So we've got countries in a sort of more traditional development context. We have a number of countries and settings in emergencies. So we've got examples in the report from Ukraine, from the Gaza Strip, from cholera treatment centers in Lebanon, as well as countries in ongoing conflict such as Mali and Niger in the Sahel. And we've also got examples of countries in upper middle and higher income settings, which is really exciting too. If you move on to the next slide, we'll see that we also have in the report a number of case studies, and these case studies are from all regions of the world, so very diverse settings again, and covering a lot of different topics. We have one from Nepal, and we'll be hearing from Nepal later in the webinar, as well as some findings from Benin also in the report, and we'll be hearing from a colleague in Benin as well today. If we go to the next slide, we see that the good news is that users of WashFit have noted multiple benefits from implementing the tool. And of course, that's the most important reason why the tool is being used, is to make improvements to these important services. So more than 2/3 of users found improved operation and maintenance as a result of using WashFit. More than 50% of countries reported that WashFit resulted in improved staff satisfaction, 60% in improved patient satisfaction, and then importantly, more than 80% actually managed to make some improvements to WASH services. So that's also really pleasing to see that our first kind of big evaluation of the tool is showing that it's been well received and that it's able to make improvements where they're needed.
That is indeed a solid track record, Arabella. If we come back to those countries that stepped up to make an endorsement or to create a national version, or countries that are considering doing that, what does it mean that a government gets significantly involved in taking up WashFit? How does that look? Instead of just kind of sharing the tool itself, what more is there to do to really make WashFit happen at the national level?
So although we see that there's lots and lots of countries using WashFit, certainly even within those countries, there's still a long way to go in terms of scaling up and institutionalization. In terms of the scale of the rollout, we see that scale varies greatly across countries. So firstly, in terms of the number of facilities, so it might be from a pilot of a few facilities up to some countries where we're looking at thousands of facilities. And we have a table on the page 22 of the report, which talks through some of those more extreme examples with larger numbers of facilities. So for example, Bangladesh, Philippines, and Indonesia have implemented WashFit in tens of thousands of facilities. Georgia, Mali, and Zimbabwe in well over 1,000. And then smaller countries like Liberia and Montenegro, where they don't have as many facilities, who have implemented in a smaller number of facilities, but proportionally, that's more facilities out of the total available in that country. Now, where we see governments, we've seen so far that governments have been actively involved in about half of the countries. But the number of countries where WashFit is being fully rolled out nationally, where it's been integrated into national policies and standards and fully financed, still unfortunately remains low. So you touched on it earlier that many countries have validated a national version of the tool. We've seen that in 65% of countries, but fewer than 1 in 4 are actually rolling it out nationally, which means, of course, there's a lot more to be done to scale up. We know that funding and financing is critical for all elements of WashFit. So for training, for infrastructure improvements, for operation and maintenance, we need to better track budgets and expenditure to better understand those needs and gaps. And we do have some examples of costing of WashFit in the report from Zimbabwe, from Ukraine, and the Philippines. So countries, in very different regions and different contexts. The Zimbabwe case study we have talks about a costing tool where both annual costs and one-off expenditures were calculated to see how much WashFit, how much it costs to run WashFit. I think also in terms of scaling up, we really need to make sure that WashFit is included in existing national curricula and as part of continuing professional development for staff to make it more sustainable. And again, we have some nice examples, one from Georgia, where WashFit is now part of continuing medical education for family doctors. And in Indonesia, where the training program there has been accredited by the Ministry of Health, and at the end of the last year their training program was scaled up across 38 provincial offices. So they now have an established set of master trainers. So that will help to roll out WashFit on on a bigger scale. But really importantly is this government leadership. And we want to see more and more countries where WashFit is being adapted and adopted at the national level.
Yeah. Well, there's some definitely more than a few early risers on different aspects of rolling it out. But for those countries that are not yet there, they've introduced it, but nothing significant has happened. What more is needed to improve that situation in those countries? What would you recommend happen in those countries?
So if we go to the next slide, we've got here the list of recommendations that came out as a result of the report. So just to go through these very briefly, I think, as I've just touched on, we need much more to be done to institutionalize WashFit into government and health programs. We need greater operational monitoring and real-time data sharing. And we are seeing more and more examples of online data collection tools being used. So through Kobo Toolbox and data visualization through the Power BI platform. And we've got some nice examples in the report from the Middle East, from Venezuela and the Philippines, where this is already being done. Financing and funding for implementation, of course, is essential, as well as engaging local municipalities. So making sure that local government is really involved in the process all the way through. And we have some nice examples on that from Mali and Nepal. In terms of streamlining with health, energy, climate tools, that's important for a more effective use of resources. We know that resources, of course, are limited. So realizing the co-benefit between different programs and making sure that WashFit is not a standalone tool and package, but is part of broader health system strengthening. Two nice examples of that are in Vietnam and Laos, where WashFit has been integrated into their national climate tools. And improvements and assessments are conducted as part of those wider national climate approaches. There's in terms of there's a big focus in WashFit now on not only on climate but also on strengthening gender, disability, and equity. So recommending that experts and stakeholders from those groups are engaged throughout the process. So they're members of the WashFit team, they participate in WashFit meetings, in the planning process. And there's a really nice example from Indonesia where they have involved local disability groups in planning processes, but also importantly, in deciding what improvements were most needed. So making sure that the improvements that happen are the ones that are most relevant to health facility users. And then lastly, to say that in emergencies, where, as we're saying, there's more and more emergency settings around the world, WashFit should and can be abbreviated. So the full list of indicators in the WashFit assessment is there are 96 indicators, which may be overwhelming in critical emergency contexts. So reducing the number of indicators that assess, targeting improvements to a smaller subset can really work. And that one example we have again in the report is from Gaza, where a simplified list of indicators was used when the capacity was low. So yeah, lots of things that we can certainly continue to work on.
Yes. And you mentioned the health systems strengthening. And if we come back on the government actors at the local level, regional, national level, we do hear that WashFit is a tool for health system strengthening. How does that work?
Yeah, so that's a good question. So WashFit is one of the 8 practical steps. And if you move on to the next slide, we've just got a snapshot of what those 8 steps are as a reminder. These 8 steps are the building blocks needed to improve wash-in healthcare facilities and health systems. And it's based on a distillation of what we know works in countries based on observations of 50 countries in a range of settings. So WashFit is included under step 4, improve infrastructure. And it's just one example of a tool that can be used. It's not the only tool. There's, other countries may have their own program, and that's absolutely fine. We're not, as WHO and UNICEF, prescribing that it has to be WashFit and nothing else. But WashFit is one tool that can be used to improve infrastructure. But WashFit in turn can contribute to all the other steps. So it can be used for ongoing data collection and monitoring and help generate data for baseline estimates. And as mentioned before, particularly if that's done using online real-time data collection and sharing platforms. It can also inform progress to meet national targets and importantly, guide facilities to meet existing national standards on WASH, on waste, on IPC. It's also a mechanism for greater community engagement and for workforce development. And both of those, there are numerous examples throughout the report of countries where that's happening. Just as a quick aside, to say that WHO and UNICEF, we're working on an update of the Practical Steps country tracker, which will be released midway through this year. And you can read more about that, about the latest update on the WASH and Healthcare Facilities Knowledge Portal. And I'm sure a colleague can put the link to that in the chat box. Anyway, but that's just an aside for now.
Thanks, Arabella. Yeah, that's really solid how WashFit is this tool for health system strengthening. I think our upcoming speakers will be also sharing their experiences on that directly. Maybe just one last question before we move on to other speakers. In general, what are the next steps? Like, where are we going to go from here? Based on this report, is there going to be a new version of WashFit that comes out that everyone should then start using?
So we won't be producing a new tool. The good news is that the results from this evaluation indicate that the existing tool we have is appreciated. It's based on a widely validated incremental improvement model, and it meets the needs in a range of contexts. That's not to say that improvements to the tool can't be made, and we'll be considering, adding supplementary guidance, for example, additional fact sheets on water quality management, other kind of practical tools that facilities can use. But broadly, the methodology, the indicators, everything will remain the same. What we need, of course, are more resources to support institutionalization, to address all these emerging needs, and especially in middle-income countries, as I said, around water quality management, antimicrobial resistance, wastewater, how to more safely and sustainably manage healthcare waste. These are the sorts of requests that we've been getting from countries to develop more guidance and support on those. In the coming year, WHO and UNICEF will be working to support this institutionalization. So we're looking at how we can better get governments to take up the tool, how to link it to regulation of national standards, and what opportunities there are to integrate it with ongoing professional development efforts. And we'll be trying to document examples of institutionalization in a number of countries. And of course, we'll share that widely once that work has been completed. And then more broadly, and my final thing is just to say that we'll continue to work to sensitize health colleagues, countries to the use and the benefits of WashFit. And we've seen that it's tangible. It offers an opportunity to advance important health priorities like around primary healthcare, meeting IPC standards, and accelerating progress on maternal and newborn targets. So yeah, watch this space. We will continue onwards and upwards from here, and we hope that more and more countries will continue to adapt and adopt the tool going forward.
Thank you, Arabella. This is really inspiring. It's compelling. Back to you, Ryan.
Yeah, thank you both. Really exciting to hear all the findings. So pivoting to our next part of our webinar will be some country case studies on recommendations and actions. And first up, we have Miss Alice Gia from Benin. Alice is the Nimdora Project Coordinator for Helvetas Benin. And Alice, I'll turn it over to you.
Merci beaucoup. Merci de m'avoir introduit et de me donner l'occasion de partager une petite expérience du Bénin sur le WashFit. Je vais passer à la première slide, diapo s'il vous plaît. Voilà, donc on va parler du suivi, de comment se fait le suivi du WashFit au niveau du Bénin. Il faut d'abord dire que c'est à différents niveaux que nous avons le suivi selon la pyramide sanitaire du Bénin. Donc, nous avons le niveau central et au niveau central, nous avons le ministère de la Santé. Et dans ce ministère, il y a plusieurs directions techniques et nous avons la direction de la santé communautaire, de l'hygiène et l'assainissement de base. C'est cette direction qui s'occupe en fait du WashFit. Et quand on descend plus bas, nous avons le niveau déconcentré. Et à ce niveau, nous avons la direction départementale de la santé. Et sous la direction départementale de la santé, nous avons le niveau décentralisé. Et le niveau décentralisé concerne la zone sanitaire. Et la zone sanitaire, je l'ai souligné là en rouge parce que c'est beaucoup plus à ce niveau que le suivi est accentué. Au niveau central, on peut faire un suivi peut-être une fois l'année. Au niveau du suivi de la direction départementale de la santé, on peut faire un suivi 2 fois l'année. Mais au niveau de la zone sanitaire, nous avons un suivi plus régulier, disons un suivi trimestriel. Diapositive, s'il vous plaît. Voilà. Avant de venir au processus de suivi, je vais parler du processus d'élaboration du plan de travail de la zone sanitaire. Donc, la zone sanitaire qui couvre un ensemble de centres de santé, il peut couvrir 30 centres de santé, 30 à 40 centres de santé selon l'étendue du territoire. Donc, une zone sanitaire peut être une seule commune, comme elle peut être un ensemble de communes. Donc, la zone sanitaire, chaque année, doit élaborer son plan de travail. Et pour élaborer ce plan de travail, ça ne peut être que sur la base des besoins des établissements de santé qui sont à la base. Donc, avec l'appui que le projet a fait au niveau des établissements de soins de santé, il y a eu des plans d'amélioration avec le WashFit, on a eu des plans d'amélioration au niveau des établissements de soins de santé qui sont à la base. Et comme quelqu'un nous l'a confié, autrefois, quand la zone sanitaire demandait aux établissements de santé de leur envoyer leur planification, ils ne savaient pas comment s'y prendre. Mais aujourd'hui, avec les plans d'amélioration, c'est rapide parce qu'il y a déjà des plans qui sont disponibles. Ce sont ces plans d'amélioration que les établissements de soins envoient au niveau de la zone sanitaire. Mais la zone sanitaire, avant de faire son PTA, doit faire un petit travail de validation. Donc, les chefs postes, c'est-à-dire les responsables de ces établissements de santé, doivent aller dans une séance tous ensemble pour faire un travail de priorisation de ces besoins pour voir qu'est-ce que la zone sanitaire, en termes de financement, qu'est-ce que la zone sanitaire est capable d'aider les petits centres à prendre en charge, ou bien qu'est-ce que la commune est en mesure financièrement parlant de prendre en charge. Donc, c'est cette petite validation qui permet de faire la priorisation des besoins et finalement, la zone sanitaire peut avoir un plan de travail annuel sur la base des besoins des petits centres de santé. Maintenant, pour faire le suivi, justement, comme la zone sanitaire a son plan de travail annuel, elle a l'obligation de faire le suivi pour voir si le plan d'action est en train d'être mis en œuvre. Et donc, pour ce faire, la zone sanitaire va se faire aider par des agents d'hygiène qui sont au niveau de chaque commune. Et ce sont ces agents d'hygiène au niveau de chaque commune qui descendent plus bas au niveau des établissements de santé à la base pour aller collecter les données. D'abord, ils vont pour faire le suivi pour voir est-ce que ce qu'ils ont élaboré au niveau de leur plan d'amélioration. Est-ce qu'ils ont eu des avancées? Est-ce qu'il y a des difficultés? Donc, ils ont des fiches avec lesquelles ils vont faire ce suivi-là. Et ce sont les données que les agents d'hygiène de la commune collectent, qu'ils envoient au niveau de la zone sanitaire, de façon que la zone sanitaire a un visage de tout ce qui a été fait comme avancée et de tout ce qui reste à faire. Donc, voilà comment se fait le suivi au niveau de la zone sanitaire. Au niveau départemental, je n'ai pas mis ça dans cette pyramide, mais le niveau départemental, lui, il peut descendre sur le terrain 2 fois par an juste pour aller voir quelques centres de santé, alors que la zone sanitaire, elle a l'obligation de couvrir tout l'ensemble des centres de santé qui sont sur son territoire. Voilà un peu ce que je peux dire. Je vous remercie. S'il y a des questions plus tard, je pourrai répondre. Merci.
Thank you so much, Elise. Next up, we have Dr.
Oui.
We have Dr. Upendra Dungana. He is the Senior Technical Officer of the Ministry of Health, Nepal. And go ahead and take it away.
Thank you, Ryan. So I'm audible, right?
Yes, we can hear you.
Okay, thank you. So first of all, I would like to thank you all, the host and the organizers, for providing me this opportunity. And also I want to congratulate the whole team who, for their great work revealing global report on WASPIT, including information from 71 countries. So it is not a small job. It's really, I think, the great work. So Nepal is one of the countries which has been using WASFIT for last 4 years. However, it is not up to the level of at a national level. Not thousands of facilities are not yet enrolled, but we are trying to enroll as much as facilities from different sources. And this year, Government of Nepal itself has allocated some fund to district health offices to conduct, orientation and training regarding WASFIT at district level. So next, please. So today, I will be, talking about some of the recommendations. Maybe next, please. Yeah, recommendations in the report. So I'm picking up 2 of those, maybe training and also the financing and funding. Next, please. So as we all know that training is very essential and is key for learning about the tools among health workers, and also to provide skill to conduct assessment, and also to prioritize the gaps that has been identified regarding WAS in healthcare facilities. So the WASFIT training, with the outputs, that means when WASFIT trainings are conducted, which resulted on producing action plan of the health facilities of those participants, is really useful for finding funds and also negotiating funds with the local government. So each training, if it is linked with the action plan, will be really worthy to make it implement. And also after the training, in our experience, the follow-up of where there is follow-up and also the improvement in the action plan, the result was better. So trainings, once there is a training for different health facilities, maybe at least one follow-up is required to make them used to with the tools, and also to improvise their action plan. Another important aspects is the repair and maintenance of the the WAS infrastructures. So maybe in smaller health facilities, along with these WASFit, the training on the tools, the repair and maintenance training is also equally important, to make WAS services functional. So the training could be provided to the staffs within the facility, or maybe some people from the community, and also providing or equipping them with some basic tools is really, really good, and also that has great impact on the functionality of the services. And another is the team meeting within the health facility, which includes the technician and also the local community people, is really important to institutionalize the WASFit. So the regular meeting of the team also we found that is very useful from our experience. Next, please. Oh, sorry about this transition. So if we talk about the funding from our experience, there are a few great examples that many local, not the local health facility, but the local government are contributing for WAS services. You can see some of example here. One of the UNICEF supported, the program where almost 34% is of the total cost was contributed by local government and local, the organizations. And also during the if there is any external support for these WASFit and WAS in healthcare services, whenever in many experiences, in many cases, we have done a tripartite agreement between the health facility, local government, and the external funding agency, where local government has ensured at least 25% of the cost, or they have contributed for that, and in many cases it reached up to 80% also. So whenever there is the good action plan, the funding is also coming at local level to improve the WAS facilities. So one of the study that has carried out by the Lakshmanji and others, a municipality has established where there was a WASFit program, recovery fund of 3,800 US dollar, which was used only for the operation and maintenance of WAS services. That is the exclusive fund for O&M of WAS services. This is also a really good example, and also many municipalities, they have prepared O&M and sustainability, the guidelines for their health facilities at local level, and also many other these rural municipality, they have also committed to provide the funds, or committed for financing WAS in healthcare facilities. So these are some of the examples that we have found in many local levels in Nepal, where there is WASFit training, and also some WAS in healthcare facilities activities. Next, please. So the another aspect is the reward, recognition, and review is also equally important to sustain, and also for the internal healthy competition, where some of the some of the provinces in Nepal, they have awarded health facilities based on the WAS functionality in healthcare facilities. So this the rewarding system has really helped or encouraged health facilities to improve their WAS score. Next, please. I am towards end of my presentation. So this is example from, these are some photos from rural health facilities where they have tried to manage healthcare waste within the health facility. So finally, what I would like to add is integrating WASFit with the current health health system. For example, in case of Nepal, the integrating WASFit with another, the minimum service standard program, which is actually the many of thousands of health facilities, they are carrying out these MSS. So they biannually they fill up the questionnaire checklist, and they have the scores based on the MSS. So we are trying to, in maybe in the next MSS score amendment, the standards amendment, we'll put all the WASFit questionnaire over there, so that it would be more efficient also, so there will be no need to carry out the separate assessment for this WASFit. So thank you once again for this opportunity. Thank you.
Thank you so much. So we are now going to, move on to discussion. So if you haven't figured it out, you can add your questions to the Q&A feature in Zoom. It might be showing up. I'm seeing it on my computer. There's a circle with 3 dots that says more. You can click on that and you'll see Q&A, and you can add your question. If you're having trouble doing that, you can drop your question in the chat and we'll get it to the presenters. So this discussion's open to all of our presenters. So you feel free to direct your question to one of them. Otherwise, I will direct it to everyone. And the first question I have here is related to implementing WashFit. I'm wondering if someone, maybe Arabella, if you could give your experience, and maybe if we have a country experience. If I'm new to WashFit and I'm looking to roll it out for the first time, what does that implementation process look like?
So thanks. Yeah, that's a very good question. And I would actually refer you, I was going to talk about this at the end of the webinar, but actually maybe this is a useful time to mention it now, that we have an online training course for WashFit, which is hosted on the Open WHO Academy. So this is an online course which is to enable participants to get a foundational knowledge of WashFit. So everything from the very first initial part of WashFit, so from the inception all the way through to rollout. Of these, there's 16 modules, and there's one particularly which talks through the stages of what needs to happen before before you even started using WashFit. There's also so of those 16 modules, there's a module for each of the 5 steps of the WashFit cycle, and it will take you through all the tools that exist, all the processes that need to happen. If you were starting WashFit from scratch, the first thing to do would be to do some sensitization at the national level. So this typically involves a review of the tool, by the government, by implementing partners, with stakeholders, looking at how the WashFit tool can be adapted to the national context. And I mentioned earlier that 65% of countries using WashFit have got have an adapted version of the WashFit tool, which means that the indicators have been reviewed and aligned with the national standards of that country, if those standards do exist. Then there would be a process of a pilot program, so doing some initial training and rollout in a selected number of facilities, looking at to see, what works, how the tool can best be adapted for that specific context. And then that will go all the way through from that initial pilot stage through to a wider rollout. Once you've shown proof of concept, to then to roll out with more funding once it's been integrated into those national systems. So again, I would encourage anyone who's new to WashFit, and even those who are more familiar with the tool, to please take a look at the online training package that we have, which will take you through all the steps and give you that foundational knowledge of everything related to WashFit.
Great, thank you so much. Unless there's another response from the other panelists, I'll keep moving along with questions, and panelists, feel free to jump in and answer any of the previous questions if you have any additional thoughts to add. So the next question I have here is, and this might be good for John, I'm wondering if there's a platform or an app to create a dashboard and monitor the indicators and progress over time. As an example, mWater provides this opportunity to measure the indicators over time. I wonder if anyone could reflect on experiences of using different digital tools to monitor WashFit.
Absolutely. This is a very relevant current question that we're also looking at and reviewing as a community of practice. I would say that UNICEF has done some really solid work in Latin America and now in the Middle East region, looking at how they can use simple tools, having WashFit on Kobo data collection, mobile data collection tools, using Power BI, kind of off-the-shelf tools to visualize that. And they found a lot of really interesting, simple graphics that can serve multiple purposes. Purposes which are making sure that the local actors themselves are aware of the situation and can follow the situation. But not only that, advocacy for what is needed, showing how over time some indicators are improving, other indicators are not improving. Where do we need to generate resources and allocate resources? There are great examples as well in the Philippines. They have a national platform where WashFit is there, and they're looking at how they can, in fact, make sure that is better integrated. So, yeah, there are quite a few tools, and it's important to keep heading in this direction. And we'd be really welcome to work with you on that. We do have a small community of practice looking at digitization of WashFit.
Great, thanks, John.
Ryan, can I just make a quick note on this?
Sure, go for it.
This is Lindsay Denny from UNICEF. Just a quick note that actually there's a case study even on this in the report. See page 26 to learn more about this. And this is a note for many of the questions being flagged here. I highly encourage you to take a look. The report's not super long, and there is a breakdown of different case studies that might help shine light on some of these questions. Thanks.
Thanks, Lindsay. There's another question here. How often should we assess WashFit? Do we need to create an action plan for the next cycle, or should we focus only on the assessment?
Maybe if I come in on that one. So certainly WashFit is not just for doing assessments. It's about the whole cycle of improvement. We recommend that an assessment should be done every 6 to 12 months. So there are some indicators that will likely change more often than others. So for example, does your facility have a water supply? It is not likely to change. Those big infrastructural questions unless you've gone through a huge infrastructure upgrade, are likely to have stayed the same. over 6 months. There are some things that need to be assessed more regularly. So there's a checklist in the back of the WashFit guide, which provides some of the suggested spot checks that you might need to do on a daily, weekly, monthly basis. So, checking that taps are not leaking, checking that there are hand hygiene supplies in place. Some of those things need to be done more regularly, but we recommend that the full WashFit assessment with all the indicators should be done every 6 to 12 months. Once the assessment is done, then the important work starts. So the assessment is really just the beginning, and based on the results of the assessment is developing an improvement plan. So looking at the potential problems and gaps that there are in the facility, what risks are related to those problems, and then coming up with an improvement plan. So definitely don't just focus only on the assessment, but think about the broader cycle, and of course, take action on that improvement plan. So it's not just writing an improvement plan for the sake of doing it, but actually, addressing some of those problems. And we in the WashFit guide, there's more information on how you can prioritize those improvements. So focusing on some of the small, quick wins that can be done immediately with very limited resources, and then how you go on to prioritize some of those bigger items that will require more resources and more time to complete. So yeah, please do refer to the WashFit guide on that. And also, this is all covered in that online training package that I mentioned as well. So that if you take that course, it will also take you through all of those steps and how you should complete them and in what time frame.
Great. The next question we have is, are there any monitoring tools accessible to everyone to see the correlation between the results of the WashFit scores and climate-related data and/or other health-related data?
Yes, so if I understood the question correctly, is whether there are tools to look at the correlation between the results of WashFit and climate data. We don't have any such tools, or there are no tools that we know of that serve that purpose at the moment. However, there is we're looking at how we can better align within WHO the WashFit tool with climate-related assessment and improvement tools, and there is a box on that in the new report which you can have a look at. I don't know if any of my colleagues want to jump in with any other suggestions on that, but that's not something that we've addressed so far. One thing I would say on the climate, again, in the latest version of the WashFit guide, which was published in 2022, we do look at best ways of aligning WashFit improvements from a climate angle. So what are the most important things that can be done that can improve climate resiliency, sustainable practices within a healthcare facility? So there's a fact sheet on that in the back of the guide. So again, would suggest that you take a look at that. And again, to plug the online training package, we have integrated climate considerations throughout those modules. So for each of the technical modules that look at water, at sanitation, healthcare waste, hand hygiene and cleaning, there are considerations about what are the sorts of climate-friendly practices that you can do as part of those improvements.
Thanks. And maybe just to interpret this other part of this question a bit further, Arabella, if you're aware of, are you aware of anyone who has used WashFit data and attempted to link that with, say, other either health outcome related data or other sort of facility level benefits to show the impacts of WASH improvements on various health or non-health related outcomes?
Yeah, so that is a good question. To our knowledge, we don't have any particular examples on that. We found that most of the evaluations of WashFit look at specifically service level improvements and some of these things around that we mentioned, like patient satisfaction, staff satisfaction. Measuring health outcomes is more difficult, particularly because that data is difficult to collect, but also because it can't necessarily be directly correlated to WashFit. So at this present time, we don't know of any examples where it's looking at specifically at health related to health-related data, but there's more around sort of quality of care, experiences of care that we're seeing. But that's certainly something that later down the line with more resources might be a possibility.
Great, thanks. This is a bit of a technical question, but there's a question here about the appreciation for the online training with the WHO Academy. Apps, I guess there's apps in Android and iOS. Could you provide an update on when the Academy apps will be fully accessible? Since it sounds like they're still under development. Do you have any insights on that?
I'm afraid I do not. That's possibly a little bit too technical for me. So the WHO Academy, the WashFit course, for anybody that had previously enrolled in the WashFit course on OpenWHO, this is just to say that the course is no longer available on that platform. So if you try and continue the course that you'd already started or register there, the link won't work. So you'll have to migrate over to the WHO Academy. I don't know any plans about transferring onto an app. I imagine that it's accessible on a mobile-friendly version on a web browser, but not specifically on an app. But it's relatively newly launched on the WHO Academy. So for the moment, I think the best bet is just to access it as you would normally on your computer.
Great, thanks. I think that's all the questions.
Ryan, there's a good question in the answered section from Lisa that I actually think would be great if we could have the folks look at. Lisa Rudge.
Yeah, great. So the question here is, are there any good experiences of using WashFit for supporting health facility level planning and budgeting for maintenance and operations or repairs? How did the WashFit tool help convince decision makers at the health facility or district level or authorities to budget for O&M?
So we have a couple of examples in the guide about costing. So I think I mentioned already Zimbabwe has done a costing exercise. There's been some work done in the Ukraine and Philippines. My colleague Maggie might have more insights from the Ukraine work about whether that's particularly led to improvements in O&M. I know that also John and colleagues work in Mali and Nepal, I think, have had examples where the WashFit process has resulted in bigger budgets being allocated at the municipal level. So perhaps, I don't know, John, if you want to jump in, if you've got any particular insights on that resource allocation that you might be able to share.
Yes, in Mali, Nepal, Benin, there are cases where just the awareness of the population about what's happening in the healthcare facility, just that conversations can be started about the status of WASH indicators. Then there can be days organized. In Mali, they've organized des journées d'interpellation démocratique, these days where there are town halls with the municipal council. They talk about the WashFit indicators. They see what improvements could be made. Some commitments are taken by the municipal leaders within what is in their means. So I think that's the real power of WashFit. I don't know, Alice, if you have something more you'd like to add from your experience in Benin, or Dr. Upendra in Nepal, on these particular areas where WashFit is starting conversations and leading to local level resources being invested. Thank you.
Merci beaucoup. Comme John l'a dit, nous sommes à des étapes de sensibilisation. Il faut dire que WashFit, on va dire, a ouvert un peu les yeux sur la question du WASH au niveau des centres de santé. Et aujourd'hui, comme je l'ai expliqué dans la planification, les mairies, les communes planifient des réalisations d'infrastructures aujourd'hui, et dans la planification que la zone sanitaire fait, on essaye de voir qu'est-ce que la commune veut donner comme contribution pour que les plans d'amélioration au niveau des établissements de soins de santé puissent être implémentés. Donc, les plans d'amélioration, là, sont des outils déclencheurs, si je vais dire comme ça, à ce que les autorités locales puissent avoir un œil aussi sur ce qui se passe au niveau des établissements de soins de santé et de contribuer financièrement, même si le financement est petit, est dérisoire, mais c'est déjà des petits pas et nous espérons que ça va aller un peu plus loin. Voilà ce que je pourrais dire. Merci.
Merci, Alice.
Just really quickly, Ryan, in like 10 seconds, in Ukraine, we do have evidence, and I posted in the Q&A an article we just published that we had municipal governments were coming in and putting in additional boreholes, upgrading piping. So the detailed assessments that were done using WashFit in Ukraine did lead to additional resource allocation, including on capital investments.
I just want to share, I know, as Joan already mentioned, the experience from Nepal. Simple awakening of about the status of the health facility, their health facility, has motivated them to put some funds towards the managing WAS facilities. Actually, they are unaware that there is minimum standard of the WAS for healthcare facilities. So that is kind of the triggering them about the WAS is also an important the services in health facility besides other curative and other immunization, all those services. So this is one point, and another is whenever there is a kind of project or additional funds or support in the WAS sector is coming to the health facility or municipality, at that time there can be kind of agreement which municipality is going to contribute the highest amount, or kind of like 25% local contribution is mandatory for that project. So there is a big the WAS in healthcare facility project supported by USAID in Nepal. So in all municipalities, they have contributed at least 25%, even for the big infrastructure, for example, toilets, water supply, all those things, and also establishing the operation and maintenance board. So I think these two points are that really helping municipality to internalize the need of WAS and also putting some money in it. Thank you.
This has been a really rich discussion, and I really appreciate everyone's insights and excellent questions, but I do know we're running up on time. I want to turn it over quickly to Arabella, just if you want to make one last quick pitch about the WHO Academy, and then I'll close this out.
Yeah, just to say, please do, we do encourage everyone to join, to participate in that training. The idea being that it gives you a really solid foundational knowledge of WashFit, and in the future, anyone participating in a face-to-face training, in-person training, would be expected to have completed the academy training as a starter. So far, we've had about 7,500 enrollees across the world, and so far the experience has been overwhelmingly positive on that. People have found that it's been particularly useful to better understand the tool, and have been, after enrolling in the course, are now starting to implement WashFit where they work. So we'll put the link to that in the chat box, as well as our contact email. If you have any other experiences to share on WashFit that maybe weren't captured in the report, perhaps you're in a country that wasn't included in those 70 countries, we would love to hear from you. So please do get in touch. And we'll continue to share more examples of WashFit through our Washington Healthcare Facilities newsletter that goes out regularly. So again, if you have examples or case studies that you want to share, do get in touch, and we'd be really happy to share those with the global community of practice on WashFit. And thank you to so many of you for joining today's webinar. It's really good to see so many people from all around the world interested in this topic. So big thank you to everyone.
Yes, thank you so much. So thanks again for joining. This recording will be posted to the YouTube channel shortly. If you'd like to follow up with anything, please feel free to email anyone if you have follow-up questions. And stay tuned for upcoming webinars. We have a lot lined up for 2025 on waste management. Actually, we're going to WashFit's so popular. We're planning on doing another deep dive session, wash insecurity in healthcare facilities, and many others. So stay tuned, keep posted to your email, and join us for the next session. Thanks, everybody, and have a great rest of your day.
Bye-bye.
Bye.
Bye-bye.